The new Cardiovascular Horizons Conference attracts leading cardiologists from around the world to share best practices, advancements, and insights in the field. Here today to discuss the conference is Dr. Craig Walker, Interventional Cardiologist on the active medical staff at Terrebonne General Medical Center, President and Founder of Cardiovascular Institute of the South in Houma, and Chairman of the new Cardiovascular Horizons Conference.
New Cardiovascular Horizons is a conference that we set up early on in an effort to simply better improve care overall, but specifically peripheral vascular disease, people who have blocked leg arteries, blocked leg veins, and impaired lymphatics from the legs. Now, the reason this is so important is because people with sick legs are often sick people. There's a strong association between these people having heart attacks and strokes and other things that have nothing to do with their legs. So if someone has just a poor pulse in the legs, even if they're asymptomatic, it is very important. And we want to bring attention to this. There are far more people that die because of peripheral arterial disease than breast cancer. Yet we don't have a Susan Komen Day. We don't have days associated with people simply paying attention to this huge healthcare problem that affects more than 20 million Americans. We simply need more attention, and we need to educate healthcare providers as to its importance to get better results. New Cardiovascular Horizons is the biggest peripheral vascular conference right now in the whole United States. People come from around the world for this conference, and of course we have physicians of every genre. We have cardiologists, surgeons, interventional radiologists, podiatrists, certainly all sorts of the specialties that treat peripheral vascular disease, in particular with intervention. But in addition to that, we have nurse practitioners, we have technicians, we have family physicians, because we're trying to educate really the entire world about how to better treat this huge health problem. So our goal is to educate about how important making the diagnosis is, to talk about treatment, and there will be many, many live cases going on throughout the conference. There'll be 30 live cases that go on during this conference from all over the world. There will be some from Germany, some from Italy, some from many different sites in the United States by some of the world's very best interventionists. Now, the reason that live cases become so important is that's how doctors learn technique. And so it's no different than doing a case without a live audience. Other than that, it's a little more stressful for the doctor, but it is how we can educate. It does one more thing. Often when someone hears of a leg being saved by these less invasive techniques, they say, well, that's a 1 in a million phenomenon. It is not. And when people see successful case after successful case, it becomes very obvious that it's far more common that we see success than failure. Yes, so the first day of the conference, we have 2 sessions. We have a fellows course, which are physicians in the final stage of training before they go out to start practicing in the world. And we also have a course which is meant for hospital administrators and for practice managers, talking about the importance of peripheral vascular disease for hospitals, for programs, for communities, etc. In that program, we have world leaders. We have the titans of industry, all of the presidents and CEOs of many of the great companies in the field. We have just phenomenal dignitaries that show up. In the past, we've had people like the man who made the first balloon, the man who made the first stent. These are the sorts of people who are there. And they're people who have changed the world, and yet they remain enthusiastic about trying to get this message out. So when I speak of peripheral vascular disease, I'm really thinking about several things, and I want for you to envision circulation. The reason that William Harvey came up with the word circulation is there's a circle. There's a circle going on. So if we start at the heart, which is a pump, the heart pumps. Blood goes out arteries to get to tissues. At the tissue level, there are capillaries. And at the end of the capillaries are veins which carry blood back to the heart to start the cycle all over again. So that's why it's called circulation. Now, there's also another component in there, and that's lymphatics, because as blood goes through the capillaries, sometimes there's a little extra fluid that's not just blood, and that's drained by lymph channels. And those are all together what make up peripheral vascular disease, either disease of the arteries, which stop us from getting enough blood to our legs, or disease of the veins, in which case our legs swell up tremendously and they may hurt, particularly if we're standing for long periods of time. The blood may not return properly to the heart, and that's a problem. There are problems with lymph channels. That creates what we call lymphedema. One can lose a leg from any of those problems. They're all very important and they're very common. So what symptoms do we have when we have peripheral vascular disease? Well, with vein disease or lymphatic disease, because we have impaired return of fluids, you have edema. The leg swells. It becomes very swollen. In cases of vein disease, one may develop on the inner surface of the ankle big ulcers, and in fact, people may lose their legs because these get infected. I've seen patients who've had venous ulcers in excess of 20 years, and being able to treat the vein problem was able to solve that problem. Some of these people, because the blood is simply sitting here in the leg, in the blood there's iron, because that's what hemoglobin has. It has iron. That's why we give people iron if they become anemic. Well, if that blood just sits there, it stains the skin, and so the skin will often turn a darker color. There, it's like a tattoo from within. That would be another sign of venous insufficiency. Restless leg syndrome at night is a sign of venous insufficiency. Early fatigue of the legs is a sign of vein problems. And of course, the absolute worst problem that we can have from a venous disease is if we develop a clot in the vein that travels out to our lungs, and we call that pulmonary embolus, which is the third leading cause of sudden death in the United States. So vein disease is a big problem. Now let's go to the arteries. I call it the hidden killer. So to start with, most patients with peripheral arterial disease either do not have symptoms at all, or they ascribe their symptoms to other causes. Like many of them say, I'm just getting old, or I've got arthritis, or I have other things. And so they blow it off, not thinking it's a real disease. So first off, most people don't have typical symptoms. Now, the most typical symptom of peripheral disease is when a person walks, if the calf muscles cramp, only with walking, and when they rest, that cramping pain goes away. That's called claudication. If you have that, almost always that represents blocked arteries. Now, as we go a little bit further in the path, the next thing that may happen, and this is much worse than claudication, is rest pain. Rest pain is when a person must sit or lay down, but keep their legs hanging down because the blood flow is so poor, they need that extra gravity to support to get enough blood to the starving tissues of the feet. And then, of course, it gets much worse. Ulcers and then gangrene. And gangrene is not pretty. It's bad, and that's the leading cause of amputations by far. And certainly, with proper training, we can treat even the most advanced of cases, but not as effectively as if we get to them early. I would love to see, instead of getting people who have dead toes that are infected, picking this disease up earlier and maybe stopping the disease progression, making sure we get these people to quit smoking, making sure we control the diabetes, making sure we treat the blood pressure, making sure we control the cholesterol, starting them on exercise programs. If we do that early, then we don't need the heroic treatments at the end. We want people trained in those because there will always be a need for the heroic treatments. But really, the key behind this is to tell people this is a very, very critical disease. Don't blow it off. This is serious stuff. When I've been asked, why did I start New Cardiovascular Horizons and put the kind of effort that I put into this conference, it was really pretty simple. I was tired of seeing people have the wrong care with peripheral vascular disease. And what do I mean by wrong care? I mean, often patients have blocked leg arteries and nothing's done. Now, I don't think that someone with a blocked leg artery who has no symptoms should have anything necessarily done to their legs. But that patient is at high risk. He's at high risk of heart attack, high risk of stroke. He should be counseled that he must quit smoking, that he should watch his cholesterol, that his blood pressure be controlled. If he can tolerate them, perhaps he should be on one of the drugs that stops clot, some of the antiplatelet drugs. We should feel carefully to make sure that person does not have an underlying abdominal aortic aneurysm. So this is a big, encompassing problem, and we really have to get our arms around it. If the problem is this big, our arms are maybe reaching this big, we need to get much bigger. We need to do away with amputations, or certainly make them much less common. We need to not keep missing this diagnosis. We have to make people understand its importance. And we want this event to be sort of a family affair, if you would, that people could come, learn in a very comfortable setting. And the biggest goal for me at the end of the day is to improve the care of these patients, and on the very high-end level, to make sure that every attendee, when he goes back, can better treat patients. The conference is going on now, May 30th through June 2nd, at the lovely Roosevelt Hotel, which has been remodeled, and it's just beautiful.
National Cancer Survivors Day is on Sunday, June 4th. It's a day that cancer survivors across the nation can come together to celebrate. It's also a day where we raise awareness of the challenges of cancer survivorship. This is the 30th annual National Cancer Survivors Day. It's really a special day. We will be celebrating on Friday, June the 2nd, and it's going to be at the Cancer Center on the second floor in the events room. It's a beautiful room, and it's nice and light and airy, and so everybody should feel really comfortable there. This year, we're doing an ice cream social. It's the same thing we did last year. And it's just a great time for people to come and make their own sundaes. We'll have lots of fun toppings and just a delicious treat for them. All cancer survivors are invited to this celebration, in addition to their caregivers, because we want to celebrate them too. They got through the journey with their survivors together. Staff come to say hello, and sometimes our physicians pop in because they want to celebrate with them. And we have a banner for all the survivors to sign that we'll keep and hang in the Cancer Center for the rest of the year until we can do it again next year. Mary Perkins TGMC Cancer Center is dedicated to our cancer survivors for the rest of their lives. Once they become a cancer patient, they become part of our family. So we're here for them whenever they need us. And our doctors are so dedicated to keeping them healthy and giving them a good quality of life. Throughout the year, we also offer support groups, including Nosotros, which is a faith-based group where people come together, and it's a time for them to share, and they get together once a month, and it's kind of like a little survivor reunion every month. And that's a fabulous group. We also partner with American Cancer Society to provide Look Good, Feel Better. Look Good, Feel Better is a program where they come in and tell the ladies to bring their wigs, and they'll help them style it and give them little kits with makeup and everything. So they do their makeup and their hair, and they make them feel beautiful for a day, and those are on pre-scheduled days. We have a Beautiful You program, which is a room that we provide with hats and scarves and wigs at no cost to the patient. They can come in and get a wig if they need it. We organize National Cancer Survivors Day to celebrate here in this community because we really love our patients. We're dedicated to the community and to our neighbors and to our families, and it's important to us that we are part of a national celebration so that our community and our patients feel like they're part of a bigger effort going on across the nation.